Black balloons to remember healthcare workers who died of COVID-19. Here, at the Hospital Durand in Buenos Aires, doctors, nurses and aides say they're deeply concerned for themselves and their colleagues as the virus continues to spread.
There have been 60 deaths of healthcare workers throughout Argentina and 16,888 infected healthcare workers. We will have beds here in the city of Buenos Aires. In the province there will be beds, but for sure there won't be workers to attend those beds. There'll be virtual beds.
Argentina was one of the first countries in Latin America to impose a lockdown, and even though in the beginning it was able to control the spread of COVID-19, cases are once again on the rise, leading the government to announce another extension of the country's quarantine. In spite of the virus, thousands of Argentines took to the streets last Monday to protest against the government and the lockdown. Many believe 5 months of total lockdown is too much.
It seems to me that, as in other countries, we should be trusted to behave like adults and responsibly resume work and moving the country forward.
But as discontent is on the rise, so is the effort to help produce a vaccine. Last week, Argentina announced a local laboratory will start manufacturing the highly promising Astra Zeneca Oxford vaccine. Assuming the vaccine is proven effective and clear safety trials, Argentina will then distribute it to countries throughout South America, with the exception of Brazil, which is producing its own vaccine. Argentina and several countries in the region have been on lockdown for months, and this has had a dramatic effect on the economy and on people's lives. This laboratory is in a way a guarantee that countries in this part of the world will be able to access the vaccine as soon as possible. Lucas Filguera Rizzo says production will start within weeks.
We started the work with AstraZeneca and with the tech transfer. We already started. We are purchasing things at risk, and we will start producing even if the results are not yet there. We are waiting the results for October, and we will more or less start in that time frame, but we are not waiting for the results. We are just moving as fast as we can.
The lockdown has helped preserve life in Argentina, but it has also exacerbated an already difficult economic situation. The challenge now is to jumpstart the economy without an increase in loss of life. Teresa, Al Jazeera, Buenos Aires.